Thank you, Uli, and thank you for hosting me. And I should say, actually, my day job currently is I'm with Sutter Health. I'm the Director of Medical Affairs for Acute Psychiatric Services in our Sutter Health system, which is a 21 hospital system in central Northern California. Okay, great. Can you see my slides? Good. So I'm here to talk about Lief, which is a FDA Class 2 device that's used to do heart rate variability biofeedback, which has a number of uses, but in our case, using for mental health treatment. And I'll mention the founder of Lief, Rohan Dixit, is also on the call here. The quick background, though, I'll skim over this in the sake of time, is that, as many of you know, mental health is a huge unmet need around our country, and even more so in the wash of COVID, with extraordinary numbers of people with depression and anxiety in particular, and increasing mandates for healthcare systems to provide services, including timeliness mandates, combined with a workforce challenge for psychiatrists, therapists, et cetera, to be able to provide mental health. So it's a large unmet need. As mentioned, behavioral health is scarce, it's expensive, it's hard to access if you're a patient, and it's difficult to scale and expensive if you're a provider of healthcare services, as evidenced by some recent fines that happened with Kaiser for failing to meet the demand. So Lief is a 2-lead ECG, and that's a picture of it on the left in the box, and on the right, someone wearing it. You attach it to your body using essentially EKG stickers like that. That's capable of providing real-time heart rate variability biofeedback for mental health treatment. I recognize it's a mixed audience here. Some may be physicians and some may not know what I'm talking about in terms of heart rate variability. So briefly, heart rate variability is we all have a beat-to-beat variation in our heartbeats. And in particular, it changes with inspiration and expiration, which themselves are governed by the autonomic nervous system. Exhaling is governed by the parasympathetic nervous system, the rest and digest, or rest and recover, which is mediated by the vagal nerve, which is a central part of heart rate variability biofeedback. And the sympathetic nervous system, more the inhalation, fight or flight response. And heart rate variability is essentially a function of the balance between parasympathetic and sympathetic, and really a proxy for parasympathetic tone or vagal tone. And why do we care about HRV in the mental health field? It turns out that HRV is a biomarker for a number of things, but in this particular case, it's interesting to us because it's a marker for anxiety. So on the right, this is a bit of an eye chart, and you don't need to kill yourself with it, but the key part is on the right. It's a large meta-analysis comparing people with anxiety to 2,000 people or so without anxiety, and heart rate variability is lower in people with anxiety, which makes sense when you think about the parasympathetic sympathetic balance, and that essentially the sympathetic is on a higher, out of balance with higher dominance of the sympathetic tone in folks with anxiety. Same is also true for depression. Low HRV is also a biomarker for depression. Consistently, again, about large meta-analysis, a different one of about 2,000 people unmedicated with depression, which is important, and 2,000 people without depression. And again, HRV was significantly lower in the depression group. This is just a thing, when I was joining Lief, I was like, what is this stuff, this HRV? So I did a quick National Library of Medicine search, and this graphic popped up and interested me, which shows that I think of biofeedback as kind of an old-timey thing, but HRV is really a newly emergent idea, and this is the rate of publications, shows there's a great amount of interest in what can HRV do, what can it measure, and what can HRV biofeedback do. And this is, to my mind, kind of the most important slide of the kind of data part of the thing. Again, when I was contemplating joining Lief as the chief medical officer, I really want to see what is this thing and is it really helpful? And so again, I like meta-analyses, and I found a number of large meta-analyses, one for anxiety, one for depression in particular here. I wanted to compare the effectiveness of this treatment. Many of you may be familiar with effect sizes, which is essentially in scientific literature, we have is something significant, and then we also are interested in the effect size, which is, as it sounds, how big is the effect of an intervention on an outcome. And effect sizes for medication in anxiety tend to run in the 0.3 to 0.6 range. Higher is better. CBT 0.2 to 0.7. And it turns out, again, this is quite a large meta-analysis, dozens of studies that shows the effect size for heart rate variability biofeedback is actually comparable to that for medication and for CBT. Same for depression. It's a poorly kept secret that medications like SSRIs are only modestly beneficial for depression. Cognitive behavioral therapy is fairly good, although it's a very person and labor intensive modality. And HRV biofeedback turns out to be also quite effective in the treatment of depression. So this for me was, when I was contemplating joining Lief, the real startling thing, like, wow, this really is a valuable therapeutic modality. Oh dear. There we are. So we also, Lief did their own small trial as well. This is an 8-week open label study for an anxiety, and we had significant drops in anxiety scores using the PHQ-2 for anxiety. I'm just going to quickly touch over this, but HRV has a number of potential application in HRV biofeedback. HRV biofeedback has been shown to be helpful in anxiety in people with pregnancy, in children, and also in children with autism and adults with autism. It's shown to have benefit in addiction cravings, for cognitive function, typo, insomnia as a fitness tracker, and also it's a marker for cardiovascular risk, particularly in people post-MI, as well as in how well managed your diabetes is. Thinking of you, Harsh. What is HRV biofeedback? So HRV biofeedback is the intervention to improve HRV, to increase HRV. And it's essentially a breathing technique, and this is kind of a tech-enabled or enhanced breathing technique. But what HRV biofeedback does is it's breathing exercises that syncs your heart rate with your respiration and tries to exercise the parasympathetic nervous system or the vagus nerve. What we do is it's this 2-lead ECG patch, as illustrated, that goes connects via Bluetooth to a smartphone. And this is a screenshot of the smartphone app. And what you see when you do an exercise is it's tracking your breathing and your heart rate and your HRV. And it essentially instructs you through vibrational, through haptic feedback, to breathe out and then breathe in. And then when it catches that your HRV is starting to drop, you breathe out again. And you do an exercise anywhere typically from 2 to 5 minutes, several times a day. And so the app is guiding you through the exercise for the HRV biofeedback. This is just a screenshot of how a downtime dose works, what your phone might look like. And there's 2 ways to really use the Lief. One is scheduled, what we call downtime doses, scheduled biofeedback exercises. The other one is something called an auto dose. And this is particularly unique for Lief. And because it's an actual ECG, as opposed to PPG, the light-based things such as the Apple Watch or a Ring, it's able to detect and analyze your HRV in real time. And it can detect when you're feeling stressed. It notices when your HRV drops and can trigger you with a little buzz and say, hey, your HRV dropped. It looks like you're being stressed. Do you want to do a little exercise right now? So one thing unique about Lief is it can capture you in real time when you're feeling stressed, both interrupt that, but also then that's a good moment to practice increasing your parasympathetic tone and to increase your HRV. This is just a reminder me to mention that Lief is actually a clinic, and we have Lief coaches, and you can do coach or no coach programs, where we found significantly better results when someone's using a coach. The coach is available for texting and also typically every 2-week, 20-minute coaching sessions. These aren't really therapy sessions. These are sessions where they help kind of check in, see what the obstacles are to using Lief, making sure you're optimizing how to use it best to get the best results. A coach typically does an onboarding session where they show you how to use it. It's 30 minutes. Then they build a personalized plan. They're available for chat support, weekly tracking, and then again the bi-monthly coaching sessions, which are typically over video, but they could be via phone as well. Quick, many of you are probably thinking about other things in this space. The most sort of high profile are Apple Watch, which can sort of track HRV or a ring as well. And HeartMath is a thing that you clip onto your ear. Some differences are that we're the only actual ECG in the market, so we're the only ones capable of doing real-time HRV analysis that you can also wear around at the same time, as opposed to the others where there's much more considerable amount of noise involved and not able to do this kind of instantaneous analysis. The numbers may be a little off in terms of the reimbursement, but this is mostly a reminder that Lief can be, through RTM, remote therapeutic monitoring, can be a billable service. There's a code for the device setup. There's a code for if they use it 16 days per month that's billable to insurance. And then the 20-minute coaching sessions are also billable in 20-minute increments. There's two ways to access Lief. We are a clinic where you can go onto the Lief website, getlief.com, and be prescribed it. And then it arrives in the mail in that box as insured. And then it's reimbursable through insurance. You do have to wear it 16 days or more per month for that code to be reimbursed, and the coaching plan can be reimbursed. Right now, our clinic is only in California, though we're working to expand to several of the most populous states. Or there's also a direct-to-consumer modality where you simply go on the web portal and you order it and pay a monthly subscription fee, and you can choose either coaching plan or self-starter plan. So what are the next steps? We've got a clinic where we're approaching self-sufficiency, but we're looking to expand, of course. So one is more studies. We've got our pilot study. We want to also show that not only is HRV biofeedback have a lot of great data, that Lief itself has good data. And we're currently collaborating on a clinical trial at Harvard Medical School regarding addiction. We also want to get more access. There is a problem. We feel like we have a solution. We feel like we have a highly scalable solution that could provide a lot of services to a lot of people with minimal human resources. So we're in with some clinics, but we're looking to expand partnerships with larger healthcare providers and insurers who, particularly risk-bearing organizations for whom this might be of particular interest. And of course, to grow more money, we're always open to investment partners. That's it. I will take any questions. And I think I saw that Rohan Dixit, the CEO and founder of Lief, is also in the audience here.
Great. Thank you, Matt. This is an excellent presentation. When I spoke with Rohan and he sent me a sample, I was really amazed. This is probably one of the best examples of a digital therapy that is scalable. It's not only, I think it's also diagnosing, don't you think so? It's diagnosing and also offering treatment. I haven't seen many examples of such.
Yes, yeah. We probably wouldn't boast that we can diagnose anxiety, though. I think if you got us into a bar and a few drinks, there's a lot of data suggestive of its predictive capabilities, but we certainly can't market ourselves as such.
True. Talking about reimbursement, I have a question. So you are using the remote, patient therapy, whatever code.
RTM.
Is there another code or in the future where digital therapeutics can get because I heard that some of the startups in the digital therapeutics, they try to get a new code and.
So there's also remote physiologic monitoring, which has we thought we might also be able to bill for and or double dip if double dipping is allowed. Right now, there's pretty clear guardrails around the physiologic monitoring and what can, and we don't fit into that currently. And I'll let Rohan either chat or chime in if there's anything else I'm not thinking of.
Dr. White, coming from the RPM space in orthopedics, I'm really intrigued and encouraged by what you're doing. It looks fantastic. What would, as you are delivering clinical services, what are the typical qualifications of your coaches that you have?
They just need a coaching certificate, but they need supervision from a licensed individual, i.e. me.
Okay, fantastic. Thank you.
Yeah. And so the way the billing actually works is I do the billing, and I have to, right now there's, and it looks like hopefully ongoing, some relaxations on remote supervision. But I am the one that actually is submitting the bill.
Sure, fantastic, thank you.
And there's one other question in the chat. Dean is asking, how much does the hardware cost to make?
I'm going to let Rohan add to the chat or speak up because I don't know.
Rohan, are you there?
I am, yes. It costs us about on the order of $100.
Okay. So is there a separate bill or separate reimbursement for the device and monitoring, or is it all combined?
There's the one-time setup code, and then there's the kind of the monitoring, which is the 16-day usage piece, and then there's the coach review of data essentially, and coaching billing piece. And then there's actually assessment codes, which are like $6 or something like that when they do the PHQ and GAD2 as well.
I see. You could have potentially gone as a digital tool and given it as a service to other providers. Why did you choose to actually have the providers yourself as a clinic? Is there a reasoning behind that, or is that how you already started going that route?
It's sort of a yes and. We're also exploring partnerships with other like large clinics or someone that's got a large sort of private practice or a medium-sized private practice, and they just want to do it and bill themselves. And we do actually have had and currently have those kinds of arrangements as well, where we work out a separate kind of like licensing to the clinic, and you guys just do it. We do have the coaching expertise though, which is somewhat unique. And the clinic piece is as much as anything like a proof of concept. Like, hey, can we actually make money and be self-sustaining as a company for this as well, which would be cool for us and of value to potential investors or other partners.
And so then, could you also then offer not only the device and the device service, but also the clinical service to another clinician or clinic?
Yep. Yeah. And that's a little bit, I think you're getting at, we're trying to figure out like what's our best space and how's our best model. And we're doing a little bit of all of the above and trying to see what, where the traction really is in that regard.
This is a very interesting model and very interesting device space. Congratulations to you guys, Rohan, and you all, because it's not easy to create something brand new from scratch, and that's what you guys did.
Well, I'll chalk that up to Rohan's genius, and in addition to being a remarkable individual, he's like an incredible tinkerer as well.
Yeah, I can imagine that. What is there a role for DME in this space, or because it's not durable, I guess you just throw it away? Is that why you can't use the DME codes?
That's my understanding.
Okay. Any other questions for Matt or Rohan?
Yeah, I had one question, Lee. So I thought the data on the effect size on depression, if I remember from your slide, was pretty impressive. And I was wondering, that didn't seem to be something that you're going ahead with.
Yeah, good question. It's actually remarkable that it's actually more effective for depression than anxiety, which I wouldn't have necessarily guessed before looking at it. The issue is approval for an indication, and how do we do a certain dance of a consumer available device, but also sort of showing the data, hey, these kinds of devices are really helpful for this, that, and the other thing. I think at some point we make a decision, are we going to pursue a specific approval for a specific indication?
Thank you. Excellent. Very nice.
Yeah.
I do have one follow-up question. Is anyone looking, a person looking at the EKG data, and where is that stored, or how is that looked at? The actual, the EKG data.
Yeah, and I'll take my first shot at it, and I can, Rohan. So the EKG is stored. A live human being isn't necessarily reviewing it. It's certainly, if you may be leading towards this, it's an interesting idea if we have thousands of people with thousands of hours of EKG data. In and of itself, that's an interesting concept to start daydreaming about.
Actually, I'm a cardiologist, so my standpoint is coming from a different spot. If those are $100 to make, so it's a completely separate from your business model, but those are sellable to cardiologists for mobile telemetry if there's a way for the individual cardiologist to review the data easily. We can
triple
we
dipping
use the monitors, and it looks like I have tons of people using the Alive core, but that's only when they put their fingers on the Alive core. So if this is constant data, then it's basically mobile telemetry. So it's, I don't know. Yep. It's interesting for me from that standpoint.
No, I'm totally with you, and welcome to some of the conversations Rohan and I have had. It's a whole other market, and it's big stakes when you start claiming to be able to do sort of ECG monitoring and et cetera. But it's $100, very wearable, very comfortable Holter monitor of sorts. So that's there's a lot of potential there.
I'm going to email you. Happy to be a trial center for that.
Awesome.